Good morning,
دكتورة عاملة
everybody.
اتفضلي.
My lecture today is about imaging of abdominal wall lesion. I will talk about brief anatomy about the anterior abdominal wall from superficial to deep, defined by skin subcutaneous fat, paired midline rectus muscle anteriorly, external internal oblique, and transverse abdominis muscle anterolaterally. Linea alba, midline fusion of the anterior and posterior rectus muscle, and linea semilunaris, lateral border of the rectus. Arterial blood supply, superior and inferior epigastric arteries, lower intercostal arterial branch, lumbar arterial branch, deep circumflex arteries. Venous and lymphatic tributaries can be divided into supraumbilical vein and lymphatic vessel, drain into tributary of SVC and axillary lymph node. The infraumbilical vein and lymph node drain into IVC and inguinal lymph node. Paraumbilical vein is a tributary of and communicate with left portal vein. This is diagram of normal sonographic appearance of the anterior abdominal wall, skin, subcutaneous fat, rectus muscle, linea semilunaris, external oblique, internal oblique, and transverse abdominis. This is a paired rectus muscle, and this is linea alba, properitoneal fat. By CT scan, skin, subcutaneous tissue, left and right and left rectus muscle, linea alba, linea semilunaris, external, internal oblique, and transverse abdominis muscle. Classification of abdominal wall lesion, fat-containing lesion, fluid or cystic masses and collection, solid masses, and miscellaneous. نبدي بالفات containing lesion اللي هم الليبوما, الليبوساركوما, and hemangioma. Lipoma are common benign tumor of mature adipose tissue. Fourth most common abdominal wall mass are often painless and asymptomatic. Palpable during physical examination, imaging finding of lipoma at ultrasound, CT, and MRI are often diagnostic and obviate the need for further tests like biopsy. The imaging feature of lipoma by ultrasound are oblong, echogenic, well-defined masses without posterior acoustic shadowing, little or no internal vascularity, sometimes with thin linear echogenic striation that parallel to the skin. CT scan lipoma are encapsulated homogeneous fatty masses without soft tissue component. Thin linear echogenic septa less than 2 mm are frequently seen in lipoma that parallel the skin. These septa typically demonstrate minimal or no enhancement. By MRI, ISO intense compared with subcutaneous fat on image from all sequences. Axial CT image showing a well-circumscribed ovoid mass, ovoid fat-containing intramuscular mass with a thin capsule and thin septation. By ultrasound, well-defined hyperechoic mass with thin echogenic capsule. This one. MRI axial T1 fat set with contrast are demonstrating a mass that following the fat signal on all sequence without enhancement. Liposarcoma are mesenchymal tumor and are the main differential diagnosis consideration for fat-containing mass in abdominal wall. Although liposarcoma are most commonly located with soft tissue of the extremities and the retroperitoneum, they may also develop in abdominal wall. WHO subcategorized them as well-differentiated, myxoid, pleomorphic, dedifferentiated, and mixed types. Imaging feature of liposarcoma, a mass with fat attenuation at CT or fat signal intensity at MRI with enhancing soft tissue component and presence of thickened or nodule enhancing septa should raise concern for liposarcoma. Myxoid type may appear hyperintense on T2 weighted MRI and can mimic complex cystic mass. Pleomorphic liposarcoma may appear as heterogeneous masses with hemorrhage and necrosis and may be devoid of any fat component, which may confident the diagnosis on the basis of imaging a challenge. If percutaneous biopsy of suspected fatty mass is performed, the enhancing soft tissue component rather than fatty component should be targeted. This is example of liposarcoma axial T1, T2 fat sat, and coronal T1 image after contrast, showing heterogeneous mass which expressed low signal intensity on T1, not suppressed on fat sat, with thick capsule and heterogeneous enhancement. الثird fatty containing lesion اللي هي الهيمانجيوماز are encapsulated fatty lesions that contain small capillaries, usually small slow growing lesions that are often painful on palpation. Hemangioma have no malignant potential and do not have a propensity for local recurrence after excision. The abdominal wall hemangioma in adults are often intramuscular or congenital. The patient family history is important to the diagnosis. History of trauma may also be a contributing factor. Imaging features by ultrasound are usually seen as poorly defined solid masses that vary in echogenicity and vascularity. CT scan phlebolysis in a fatty mass are suggestive of diagnosis. MRI low signal or iso signal intensity with T1 and high signal intensity with T2, which enhance after administration of contrast material, often with the flow voids. Ultrasound of the anterior wall, anterior abdominal wall, show a mixed echogenic, well-defined mass. Color Doppler ultrasound of the same mass demonstrate increased flow within the lesion. This is non-enhanced CT scan show elongated fat-containing mass with several calcified phlebolysis between the left external oblique and internal oblique muscle. هسه نجي على ثاني تقسيم اللي هو fluid or cystic masses and collection اللي تشمل الهيماتوماز والفلويد collection بالpost of patient اللي هما السيروما والابسس or cystic mass in patient without history of surgery like epidural inclusion cyst. نعم.
Epidermal inclusion.
Epidermal inclusion cyst. نعم. الهيماتوماز predisposing factor هي blunt or penetrating trauma to the abdomen, surgery or exercise-related injury may also develop spontaneously, particularly in patients with thrombocytopenia or coagulopathy, or those who are administered systemic anticoagulation medication. Abdominal wall hematoma most commonly occur in rectus abdominis muscle, اللي هي rectus sheath hematoma. Less commonly may involve lateral and posterolateral abdominal wall. Imaging feature by ultrasound, the rectus sheath hematoma appear as heterogeneously hyperechoic mass or diffuse enlargement of rectus muscle without internal Doppler flow. With time may liquefy and become hypoechoic or anechoic with a scattered echogenic component. This is a grayscale ultrasound showing heterogeneous anechoic hypoechoic area within rectus sheath corresponding variable degree of blood products. CT scan hyperattenuating mass or enlargement of the rectus muscle is the typical appearance of an acute rectus sheath hematoma. Fluid level may be apparent because of layering of blood products of different densities, which is indicative of recent or active bleeding. Administration of IV contrast permit assessment for active extravasation, usually from branches of superior and inferior epigastric arteries. By MRI, hematoma are usually T1 hyper and T2 hypointense relative to the skeletal muscle. Over time, T1 and T2 signal intensity varies depending on the concentration of deoxyhemoglobin and hemosiderin. This is axial and sagittal CT show the right rectus abdominis muscle is markedly enlarged compared to the normal left one. Also, it's much higher attenuation than the left one. Axial CT scan without contrast show rectus sheath hematoma اللي هي هذه with the fluid level. Axial CT post-contrast show extravasation of contrast, which indicate active bleeding from bilateral inferior epigastric arteries. اللي هم ذولي long white arrows. Now by MRI, there is large well-defined lentiform lesion is noted within anterior wall of right rectus sheath. It expressed T1 hyperintense مقارنة بالmuscle and T2 and T2 fat sac show mixed hyper and hypo intense signal with the fluid level and few thin internal septa. نيجي على patient with history of surgery اللي تشمل السيروما والابسس. Seroma are defined as collection of sterile serous fluid that contain plasma and relatively few red blood cells. They are commonly seen after abdominal surgery, but can be difficult to distinguish from hematoma on the basis of physical examination alone. By ultrasound, usually anechoic unilocular thin wall circumscribed fluid collection with posterior through transmission. CT and MRI are well circumscribed low attenuation on CT and of CSF signal intensity fluid collection without enhancement on MRI. Now the ultrasound of CT of Seroma grayscale image demonstrate anechoic collection with posterior acoustic enhancement. The axial CT image demonstrate low attenuation fluid collection without internal enhancement. Abscess is defined as infected fluid collection. Clinical symptoms are often suggestive of the diagnosis, including the presence of fever, periorandis drainage, tenderness, and leukocytosis. Imaging feature of an abscess, ultrasound are typically multilocular, complex hypoechoic collection with thick septa and hyperemia. Gas in an abscess at ultrasound appear as echogenic reflector with ring-down artifacts. By CT and MRI, thick wall peripherally enhancing fluid collection that often contain gas with adjacent fast stranding is characteristic. Diffusion restriction may be present on MRI. Image-guided aspiration or drainage is both diagnostic and therapeutic. This is grayscale ultrasound showing a well-defined hypoechoic complex lesion involving transverse abdominis muscle with the floating internal debris and peripheral vascularity is seen. Axial contrast enhanced, sagittal contrast enhanced CT scan show a thick wall peripherally enhancing a fluid collection lesion with gas locule inside an adjacent fat stranding. Epidermal inclusion cysts or special cysts are cystic lesions filled with keratin debris, bounded by a wall of stratified squamous epithelium. They may form during embryogenesis or as a result of occlusion of the pilosebaceous unit, or after epidermal elements are implanted into deeper tissue during surgical procedure. The imaging feature by ultrasound, epidermal inclusion cysts are usually circumscribed round or ovoid lesion with posterior through transmission, with the tract leading up to the skin. No internal Doppler flow seen. Ruptured epidermal inclusion cysts may show complex appearance. CT, they are usually well circumscribed nodule of soft tissue attenuation. MRI show high signal intensity on T2. Internal component may demonstrate signal hyperintensity on T1 weighted and hypointensity on T2 that reflect keratin depress. This is the epidermal inclusion cyst with the tract leading up to the skin, and this is the ruptured epidermal cyst. نشوف إنه تصير more heterogeneous وبيها peripheral vascularity. Axial contrast CT reveal a well-defined tubular hypodense mass in anterior abdominal wall with peripheral calcification. By MRI, T2 and T1 MRI, lesion mildly hyperintense on T2 with iso-intense to the rectus muscle on T1. هسه نجي على ثالث تقسيم اللي هو solid masses. عندنا in patient with relevant medical history abdominal wall metastasis. Metastatic disease of abdominal wall are relatively rare, unless there is non-history of malignancy. Primary tumor that metastasize to the abdominal wall include melanoma, breast, pancreas, lung, genitourinary, and lymphoma. Presence of widespread metastatic disease elsewhere in the body should further raise suspicion. Tumor seeding along the needle tract after percutaneous needle biopsy or laparoscopic surgery of malignant lesion is also well known. Imaging feature on ultrasound, metastases present are poorly defined hypoechoic masses with increased vascularity. Cross-sectional imaging finding of metastatic disease are non-specific and include single or multiple enhancing soft tissue. Heterogeneous or peripheral enhancement can be seen. Definitive diagnosis often require tissue sampling. Now عندنا multiple examples of metastatic disease. A, old female with ovarian CA, and there is large pelvic mass, discrete ovoid lesion seen in the anterior abdominal wall, superficial to the rectus sheath. B, patient with history of melanoma, axial CT demonstrates multiple circumscribed soft tissue masses اللي هي بالanterior and posterior abdominal wall. And C, patient with history of HCC اللي هو multifocal HCC with extrahepatic metastasis seen adjacent to the abdominal wall, anterior abdominal wall. البي اللي هم من ضمن السوليد ماسز اللي هي الانdometriosis, defined as ectopic functional endometrial tissue located outside of the endometrial cavity, and it's usually seen in young adult women. Typically involve the ovaries and pelvic peritoneum. Unusual extrapelvic sites include thorax or abdominal wall. The latter is often associated with cesarean delivery or hysterectomy. Classic clinical history of is the cyclical abdominal pain and the painful palpable nodule close to the cesarean scar. Imaging features by ultrasound, endometriosis usually appear as solid hypoechoic nodule with internal vascularity near the site of a scar on the skin. The margin may be smooth or irregular. CT and MRI are non-specific and show an enhancing nodule below anterior abdominal wall. The nodule is usually iso-intense to mildly hyper-intense compared with the skeletal muscle on T1 and T2 weighted MRI respectively, with or without a small foci of high signal intensity that correlate with hemorrhage. Mild to moderate contrast enhancement is present. The imaging finding must be correlated with patient history and clinical finding for correct diagnosis. This is a grayscale and color Doppler ultrasound image demonstrating vascular hypoechoic infiltrating mass at the size of previous caesarean scar. Axial CT image show a mass to the left of the midline with peripheral nodular enhancement arising from prior transverse caesarean incision. اللي هو هذا. By MRI, axial and sagittal T1 and axial and sagittal T2 images are demonstrating a mass lesion superficial to the rectus sheath that is T1 hypointense and T2 hyperintense mass signal intensity. اللي عندنا هسه البريفرال نيرف شيث تيومر اللي هو الثالث تقسيم بالسوليد ماسز بعد الميتاستاسيس والاندومتريوسيس اللي هم النيوروفايبروماس are benign tumor associated with NF type 1 that consist of Schwann cell, fibroblast, and perineural cell. These are well-defined lesions that appear in the dermis or subcutaneous tissue. Malignant peripheral nerve sheath tumor occur more often in the deep soft tissue, closer to the nerve trunks such as sciatic nerve and brachial and sacral plexus. Patients classically present with pain or focal neurological deficit along the nerve that is affected due to impingement or mass effect. Radiologically, by ultrasound, demonstrates hypoechoic well-defined mass lesion. CT, homogeneously hypoattenuating due to mucinous content. By MRI, low signal intensity bit-T1 and heterogeneously high signal intensity on T2 show mild to moderate contrast enhancement. اكو ساين تبين sometimes by MRI اللي هي target sign نشوف انه تكون hyper peripheral and hypo-intense centrally with split fat sign اللي هو rim of fat around the tumor. This is grayscale ultrasound demonstrates hypoechoic well-defined deep submuscular lesion of neurofibroma. By MRI, axial T1, T2, and T1 with gadolinium demonstrate heterogeneously enhancing mass that is hypointense on T1, heterogeneously hyperintense with T2, and showing heterogeneous enhancement after IV contrast. هسه عندنا ال solid masses in patient with no relevant medical history اللي هم desmoid tumor. Desmoid tumor are fibroblastic tumors, most often occur sporadically, but can be associated with Gardner syndrome, اللي هو familial polyposis adenomatous, are commonly located in the mesentery, retroperitoneum, and abdominal wall. Although desmoid is a benign neoplasm with no metastatic potential, it can be locally invasive and has high rate of local recurrence after resection. Imaging feature by ultrasound, homogeneously hypoechoic with internal Doppler flow, CT scan, hyperattenuating enhancing mass, MRI بالearly stage اللي هو الميكزويد, fluid signal intensity, بالlate stage الفايبرous steroid T1 and T2 hypointense. This is the ultrasound image of hypovascular hypoechoic mass of desmoid tumor. Axial CT image show hyper-enhancing abdominal wall mass centered in the left rectus muscle. By MRI, axial T1 MRI, non-enhanced T1 MRI show hypointense mass. After administration of gadolinium, there is progressive homogeneous enhancement in arterial phase and delayed phase. Sarcomas. Soft tissue sarcoma arise in abdominal wall and may be located in superficial subcutaneous tissue or abdominal wall musculature. Sarcoma that involve abdominal wall including leiomyosarcoma, dermatofibrosarcoma, rhabdomyosarcoma, epithelioid angiosarcoma, and synovial sarcoma. The various subtypes of sarcomas are not distinguishable with imaging alone. Imaging features: ultrasound, predominantly peripherally flow due to outgrowth of blood supply and concomitant central necrosis. CT scan, heterogeneous attenuation, reflecting varying degree of degeneration, necrosis, or hemorrhage with enhancement of the subcomponent. MRI, iso-intense compared with the skeletal muscle at T1, heterogeneous hyperintense at T2 with heterogeneous enhancement. This is variable appearance of abdominal wall sarcoma in different patients. A نشوف إنه الأكزيال CT image of old man with epithelioid sarcoma اللي هي هذه. B CT image show leiomyosarcoma deep to the underlying muscle of the abdomen. C axial CT show a large rhabdomyosarcoma, the anterior abdominal wall, and D dermatofibrosarcoma protuberance. E axial CT image of old women show epithelioid angiosarcoma. دي هي هذه F axial CT image of old woman show a deep infiltrating synovial sarcoma. طبعا هي all diagnosed conferred by mean of biopsy or surgical resection. Primary cutaneous lymphoma اللي هي ضمن solid lesion. Imaging feature: ultrasound nodes are found along the typical nodal drain, characteristically showing an enlarged hypoechoic node greater than 1 cm in short axis. CT show enlarged round or lobular mass lesions which demonstrate homogeneous enhancement. By MRI, hypo to iso-intense on T1 weighted, hyperintense on T2 weighted image. FDG PET scan almost always show an increased avidity and is important in both staging and follow-up of nodal and extranodal lymphomas. This is example of lymphoma axial CT image show enhancing mass in the area of anterior abdominal wall. ونشوف إنه بالaxial PET CT scan show high FDG avidity. The pathologic result show B-cell lymphoma. عندنا التقسيم الأخير اللي هو miscellaneous اللي يشمل anterior abdominal wall hernia اللي هي inguinal hernia, direct والindirect. الdirect تكون medial to inferior epigastric vessels والindirect تكون lateral to inferior epigastric vessels. Femoral hernia occur medial to femoral vein and posterior to inguinal ligament. Ventral hernia اللي تشمل umbilical, paraumbilical and epigastric hypogastric hernia. الumbilical هي the most common type of ventral hernia. They are usually small and common in women. The paraumbilical تكون large abdominal defect through linea alba in the region of umbilicus and usually related to diastasis of rectus abdominis muscle. Epigastric والhypogastric hernias above and below umbilicus respectively. The Spigelian hernia occur between rectus abdominis and linea similaris. Incisional hernia اللي هي delayed complication of abdominal surgery. They may manifest anywhere in the abdominal wall. هنا عندنا example of direct and indirect inguinal hernia. نشوف إنه هنا أكو direct inguinal hernia containing bowel loops near the epigastric vessels. This is axial CT image showing indirect inguinal hernia which contain omental fat and bowel loops. وطبعا احنا بدنا نشوفها إنه هي lateral inferior epigastric vessels. Axial contrast enhanced CT image of the abdomen show umbilical hernia containing fat and bowel loops. This is the Spigelian hernia which occur lateral to the rectus muscle between rectus and linea similaris. البي عندنا من ضمن miscellaneous lesion اللي هما injection granuloma represent localized fat necrosis, scar formation, and dystrophic calcification in response to injection of medication into subcutaneous fat. CT injection granuloma appear as small nodule with soft tissue attenuation in subcutaneous fat. MRI, the nodule are hypointense on T1, variable at T2 weighted MRI, hyper if an inflammatory reaction predominates, hypo if fibrous reaction predominant. This is axial CT image showing multiple injection granulomas seen in subcutaneous fat. Lipohypertrophy, subcutaneous fat lipohypertrophy in the abdominal wall may occur as site of subcutaneous insulin injection. At imaging, abdominal wall lipohypertrophy manifest as local asymmetric distribution of subcutaneous fat, which may be mass-like. Typical location adjacent to the umbilicus in bilateral distribution. This is axial CT image and sagittal MIP CT image showing bilateral symmetrical infraumbilical mass-like protuberance in patient with insulin injection. Conclusion: various abdominal wall lesions have characteristic MRI and CT imaging features, such as endometriosis, desmoid hematoma, usually have characteristic appearance on cross-sectional imaging, particularly on MRI, thereby aiding a confident diagnosis. CT and MRI detect the fat and cystic content within the lesion. Malignant lesions such as sarcoma, lymphoma, metastasis often have non-specific appearance, and the diagnosis is usually made on biopsy or is based on history or other secondary finding in the body. In these cases, the imaging allows detailed evaluation of the extent of the lesion of the disease.